Hi everybody. I want to talk about oral versus transdermal delivery systems for hormone therapy. Oral is the most commonly prescribed form of hormone therapy for women in menopause. It's very inexpensive, and it has, instead of having bioidentical, it's got a synthetic form of estrogen and progesterone. So it is quite a different product. Obviously, oral products are pills. You ingest them. Very similar to the compounds that are in birth control pills, but at a much, much, much lower dosage. So you do have the option of taking oral hormone therapy, and there are some drawbacks. The oral formulations are more closely associated with elevations in inflammation, increases in triglycerides, and blood clots. Um, they also can really impair libido, very much like birth control pills do. And we think the reason for this is that they increase sex hormone binding globulin, and sex hormone binding globulin acts like Pac-Man for testosterone. So it reduces your available testosterone. And when testosterone goes down, or the access to testosterone goes down, women have symptoms, low libido, including also there can be irritation or tightness or pain in the vestibule, which is the opening to the vaginal canal around the clitoris and around the opening to the urethra. So nobody wants that, and that can be a side effect. It is not the case for everyone, but it is for some women. The transdermal formulations, there's a whole bunch of options. There are gels, there's creams, there's sprays, patches, and there's rings. And essentially transdermal is through the skin. Um, and obviously our tissues, our vulva tissues, our vaginal tissues are also receptors for transdermal applications of hormone therapy. The transdermal applications are kind of in two categories. One are really low doses that are like a gel or a pessary or cream or tablet that's inserted into the vaginal canal. And that is really good for those tissues and for the health of the vulva and the vaginal canal, and prevents UTIs. So wonderful, very, very good, but it usually just stays within that area, doesn't go into all the areas of the body, versus say a patch, which provides systemic estradiol. So that is going to reach the brain, the skin, and then in my previous video on estradiol, you can learn about all the benefits of estradiol. The systemic transdermal delivery systems provide that, and the most common one is the patch. Now there is something really confusing because there are two rings that are available inserted vaginally, like maneuvering, for hormone therapy for menopause. One is an E-string, which is a lower dose, and it just really stays within the reproductive organs. And then there is a ring called a fem ring, which you insert and stays in for 3 months, which is kind of nice. Just pop it in and leave it. And that is systemic. So that is actually at a higher enough dose to kind of do two functions. One is treat any of the genital urinary symptoms of menopause, plus any cognitive, mood, memory-based symptoms, the hot flashes. All of that can be treated with the fem ring. So I'd say like the fem ring and the patch are probably the most common transdermal delivery systems for systemic hormones. If you are on estradiol and you have a uterus, You absolutely also need to take progesterone. And I want you to kind of also be clear, like the bioidentical, FDA approved, not something that you're getting from a wellness provider, but it has to be approved by the FDA. Those forms of hormones, which are progesterone and estradiol, really fit more closely to our body's own systems and are much preferable to the synthetic versions. So always choose progesterone over progestin. And progesterone comes in a little gel cap, and you can take it at night. It can help you get a good night's sleep. You can take it early, or you can insert it vaginally. So you want to take those to prevent the thickening of the endometrial lining and to prevent endometrial cancer. So yeah, transdermal, much more preferable, doesn't have the tendency to decrease libido, doesn't have the yucky side effects with increased triglycerides and blood clots. You can also have a much lower dose of effective dose with a transdermal delivery rather than an oral, which goes through your blood system before it gets anywhere else. So yeah, much prefer a transdermal delivery system.